Hello everyone, welcome to my next video on respiratory system in your CPT book, 3 series of quotes. So in this chapter, mainly we don't have any specific guidelines, so we will learn about the anatomy part. Respiratory system, it means organs related to respiration. So organs whichever is doing the function of respiration is collectively called as the respiratory system. And the process of respiration is divided into two things: inspiration and expiration. Inspiration means breathing in the air, expiration is breathing out the carbon dioxide. Our body and the cells in the body needs oxygen to work properly. So we get oxygen from the air that we inspire, and in turn the cells in our body produces a byproduct during so many chemical reactions, that is carbon dioxide, and that carbon dioxide should be eliminated from the body. So that is also done with the help of expiration. So inspiration and expiration helps us to transfer gases, or gaseous exchange is done with the help of respiratory system. And the process of getting oxygen into the blood is called as oxygenation. That means through the lungs oxygen enters into the blood, and then the blood becomes oxygen rich blood. So that process of giving oxygen to the blood is called as oxygenation. That is all done by the respiratory system. So now we will see the organs one by one. Starting from the nose, we have so many organs. So first thing is nose. So nose, as you all know, we have two openings, right and left openings, and in the middle of the nose we have a structure called nasal septum, which divides the nose into right and left side. And just behind the nasal opening we have a cavity or an empty area which is called as nasal cavity. And at the back of the nasal cavity there is a tube-like structure which connects the nose with the internal organs, that is called as nasopharynx. So when we just go down, you can see the next structure is oropharynx. This structure connects our mouth with the internal organs, and just below that we have the next structure that is called as hypopharynx. So we basically divide this organ called as pharynx into three parts: nasopharynx, that is close to the nose; oropharynx, that is close to the mouth; and the last part which is called as hypopharynx, which can also be called as laryngopharynx because it is close to the larynx. So now the air from the nose has entered into the nasal cavity, then into the pharynx. It has to move to the next structure. Between the larynx and pharynx there is an organ called as epiglottis. It is a small tongue-like structure which is present between the larynx and pharynx, which separates the food pathway from the respiratory pathway. So whenever we are eating the food should enter inside the mouth, then into the oropharynx, then it should go into the food pipe. But the air should enter into the nose. So remember that the function of epiglottis is to prevent the entry of food into the respiratory tract. So now we'll move to the next structure, that is larynx. Larynx is also called as voice box because that is the organ which produces voice in us, because it has got some structures which produces the voice. So that is called as voice box. So now we will move further down. After the larynx we have the trachea. Trachea is also called as the windpipe, and it is made up of cartilaginous structures. So if you want to feel what is a cartilage, just touch your upper portion of the ear. You can see what is a cartilage. That is how the cartilage will feel like. So the trachea is made up of cartilages. So now the air has moved from the nose into the nasal cavity, then into the pharynx, then into the larynx. Now it has entered into the trachea. So now after that it will differentiate into two structures called as bronchus. So after the trachea you can see two tube-like structures called as bronchus, right and the left bronchus. And still this bronchus will divide into smaller branches called as bronchioles. So now the air from the trachea will pass through the bronchus, then into the bronchioles. Now at last the air has entered into the lungs. Within the lungs there is a structure called alveoli, but that is not very clearly shown in the pictures and all. So now we will see about the lungs. we have right and the left lung, which are present inside the pleural cavity of the chest. It is present inside the rib cage, and the lungs are protected by the rib bones. And between the two lungs, there is a space, and that space is called as mediastinal cavity. And inside that mediastinal cavity only, we have the heart. Heart is located in the mediastinal cavity. So both heart and the lungs are protected with the help of the rib cage. And you should know about the lungs little more detail. The lungs is made up of different lobes. The right lung is made up of 3 lobes: upper lobe, middle lobe and lower lobe. And the left lung is made up of only 2 lobes, upper and lower lobe. In total, both the lungs have got 5 lobes. I have seen this as a question even in my CPC exam. They asked this: how many lobes are there in total in both the lungs? They have got 5 lobes because right lung has got 3 lobes, left lung has got 2 lobes. And outside the lung, there is a protective layer or covering which is called as pleura. And that pleura is made up of 2 layers. The outer layer is called as parietal pleura and the inner layer is called as visceral pleura. So these are the things about the anatomy of the lungs. Now, in addition to this, there is some other organs related to the respiratory system. In your CPT book, you can see a picture like this, where you can see the paranasal sinuses. Paranasal sinuses, that means sinuses which are present around the nose. So what are these sinuses? What is the function of them? Sinuses are nothing but empty spaces within the skull bone. And those sinuses are responsible for producing resonance in the voice and helping moisturization of the air that enters inside the nose, and also it reduces the weight of the skull bone. That is the function of sinuses. There are so many sinuses that are located around the nose. You can see here the names of the sinuses are frontal sinus, which is present near the forehead region, ethmoid sinus and sphenoid sinus, which are present in the inner aspect of the eyeball, and maxillary sinus, which is present in the upper jaw. So that is why whenever we get the sinus infection, we get pain in the head or near the nose or below the eyes, above the eyes and all. So that is due to sinusitis. Sinusitis is a condition which can affect the sinuses. So that is also a part of the respiratory system. Now you can note down the medical terms which we use for the organs in respiratory system. For nose, we use the term nasal or rhino. Then for the larynx, we call it as voice box. Other than that, there is no specific name for it. Then the trachea is called as windpipe. Now about the lungs. Lungs can also be called as pneumo or pulmonary. So if I say rhinectomy, what does it mean? If I say pneumonectomy, what does it mean? If I say sinusotomy, what does it mean? Already in my videos, I have shared so many videos on the medical terms. So you can check them and find out the meaning of these terms and comment your answers down. Thank you.